We're at the end of the 4th week of doing what we've been doing here. So I need to say a few things to everybody now that I have everybody here. I want to go individually, and I'm going to start with Jordan. You're doing something that, frankly, I'm a little bit scared to do myself. You're running straight into the line of fire and sticking your hand and face into the cars of people that might have COVID. Now, I would do it if I had to, but if I'm being honest, I'm very grateful that someone else was braver than I was to step up and say, I'll be the one that does that. I make a good president, but I don't make a good general. So I thank you for being our COVID warrior in this clinic. SQ, you're right there with her. You're standing right in the fire along with her, and I appreciate that. I also appreciate your ability to kind of just be happy about life all the time, no matter what's happening. It's awesome to have that energy in our clinic, especially when we're dealing with the kind of thing that we're dealing with. Angela, does anybody think that there would have been any possibility that I would have been fully stocked, plugged in with all the hospitals, plugged in with the health department, know the ins and outs of how everything happens if I didn't have Angela doing what she's doing? Not a chance in hell. Not only me and our clinic, but the county is going to owe you a debt of gratitude for the work that you've done. Thank you. Kristen? Everybody knows Kristen's heart, but I know what's in her head, and I can tell you that she has had a medical baptism under fire. She came in with almost no experience or confidence regarding being a provider, and she has been thrown into a mix that would have been hard for anybody to handle, and she has risen to that occasion with grace and humility. Good job. You've earned my respect. Tatiana, for some reason, you're like the rock for all of us in this place. It's so strange. I think it's your level nature. It seems like no matter what's happening, you can handle it. You'll get answers. You're loyal. You're a fighter. You're gonna do anything for any of us, and we all know it. We love having you as a part of our team. Newbies. How long have you been working here?
Maybe 5 weeks.
So you, okay, and so you two were hired to come work at a regular doctor's office, if you remember. But within 2 weeks, you two are immersed in the COVID Central for Marion County, which is what this clinic has become, right? I don't think that there have been two employees who have joined the heart of our family as fast as you two have. So thank you. To the whole team, I turned your professional lives upside down a month ago. I didn't ask anybody, I just did it. I just ran into the thing with the sword and screaming, and you guys are like, I guess we're running with them. Not only did I turn your professional lives upside down, but I stuck a camera in your face while I was doing it. But you all were so cool about it along the way, and there are thousands and thousands of people that love each and every one of you for who you are and what you're doing for them. So I thank you on behalf of everybody watching. And then I have to thank him as well. I guess the best way for you to learn how to become a man is to watch your dad try and learn how to become a man too. Love you, buddy.
We'll figure it out together.
That's right. We're 4 weeks in. The next 4 weeks are going to be way harder than the first 4 weeks. 97% plus of doctors' offices across the country aren't doing anything like we're doing. Doors are locked, offices are quiet, they're going about their business. What I want to know from everybody is, are we going to quit and do business as usual, or are we going to stay in this fight?
Fight. I think these people need us. No one else is going to do it.
I think they do too. Hello again, everybody. It is Friday, April 10th. This is the end of our 4th week. This is our 20th consecutive episode of Inside the Clinic. So this has been quite a journey for us. We're very happy to be able to bring this information to our county, and we're happy to be here with you to support you along the way. We hope that what we're doing here will give you a little bit of peace of mind, a little bit of clarity and understanding about what's happening locally. So let's get straight into our numbers for Friday. Cases in the United States, yesterday 455,000. Today, 488,903. Deaths, yesterday 16,114. Now 17,995. Almost 18,000 Americans have lost their life. about 2,000 Americans a day. In New York City, we just saw they're up to about 800 deaths per day in just New York City alone. So New York City is getting hit very, very hard. Overnight for Marion County, 72. We are now at 82 cases as of Friday at noon. Of course, that number is going to go up over the weekend. Still just the 2 deaths. Very good. We want to keep that number. Hopefully at 2 would be great. Hospitalizations, we do have a little bit more information here. The health department is now saying that there are 5 people admitted in the hospital with coronavirus, and the ArcGIS Johns Hopkins website still lists as 6. We need to keep these numbers low. We're doing a good job. We need to keep that up in our county. We are a donation site for PPE material and for basic supplies for the homeless. We will continue to accept those donations for anybody willing to help. COVID-19 testing sites for our county. This list, again, still unchanged. We need to test as many people as possible. So if you're symptomatic, or even if you were sick in the last month or 2 and think you might have had coronavirus, we can do either the swab or we can do the finger stick analysis and give you good information about your status. We need to test as many people as possible. This is something that I want everybody to understand, including the healthcare community. We've tested over 1,800 people. We have 82 cases, and so it takes about 25 swabs on 25 different people to find 1 positive case. So we need to be testing as many people as possible. As far as the testing sites, we are working with the health department now in close contact, and we're coordinating among most of the testing sites to be sure that we are getting accurate reporting information from our clinic and these other clinics to the health department so we can get the most accurate case report data of the patients that have been tested and, of course, the positives as well. We're going to go now to our Marion County Flatten the Curve response curve. We've got our admission data from the Agency for Healthcare Administration for Florida, and I'm just going to write these numbers down. This was Tuesday, Wednesday, Thursday. Sorry, we're going backwards. Here's Friday's numbers. Advent discharged some people. Yesterday there were 212 people admitted in Advent. Overnight they were able to discharge some people. They're down to 197. You can see how it changes day to day to day. ORMC 195, West Marion 114 people for a total 506. So we went down just a little bit for our curve that we're drawing. Get this line in here. This ticks right at 500. And as best I can, that line is just slightly lower. And just a tiny little sliver of all these admissions are people that are admitted with COVID. So we want to keep the COVID admissions as low as we can so we don't let this response curve go up. Remember, we are expecting our peak of cases and surge capacity into the hospitals with admissions to happen within the next 3-4 weeks. So we are not yet at our peak. We are getting started. We need to continue our community-wide mitigation efforts, just as we have been. This fight is not over. Earlier today, we got our finger stick antibody clinic up and running. Kelsey's doing a good job with that. That went smoothly this morning, so we're going to be ramping that up more next week. We're getting plenty of calls about people interested in getting the antibody test done, and we're going to accommodate everybody that we can. We continue to do a significant amount of swabs, and we're going to increase awareness and attract as many people that may need to be tested as possible. Remember, testing, testing, testing. We need to test 25 to find every 1 positive. So the more we test, the more we can find and the more we can get isolated. At the beginning of this thing, now we're 4 weeks in, our stated goal at the beginning was to keep Marion County one of the best counties in the country responding to COVID-19. Our goals remain the same. Now that we're at the end of our 4th week, we're going to continue our push. We are just getting started. This next month is when it really counts. I have to say again, my sincerest thanks to everybody that's been watching these videos. We're very glad that we can be helpful to you to know what's going on. Please comment and share and like and follow and all of that digital stuff that I don't know anything about. Everybody have a very safe weekend, and let's roll the tape for our Friday day. Editor, go. Back to work for me. Da, 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 da. The night is young. More mail, more Lysol. Oh, okay, yeah, that's more of the finger stick tests then. Yes. All right, so that's more finger stick antibody tests for COVID.
Kelsey, your tests are here.
Kelsey, this is for you.
Thank you so very much.
I know.
What a lovely gift.
Yeah, did you get me anything?
I didn't.
You
You can have some of my lunch.
You and lunch. Yeah, that's awesome. So we should definitely be getting AIT results. When was our first AIT test?
Was it Monday? Monday, I thought.
Tuesday.
Yeah, they did.
Which one?
No, you didn't do it the first, you didn't do it Monday, Tuesday, Wednesday.
On the 7th, but they didn't come the first day. They picked Wednesday.
That's why I say Wednesday.
And so they should have received yesterday.
Which is what she confirmed. She said we did receive.
Oh, she already knows that we were, okay.
Yep, she already confirmed that they received
All right.
that first.
I was going to ask you, are they resulting on the weekends?
I can find out.
And how do we get results for our patients that we
There's a portal, and then direct from her, there's an actual portal that you're set up with already.
Are you going to look at that, or can you get that to us
will.
this weekend so we can be looking over the weekend? I'm sure they're going to be testing through the weekend and resulting through the weekend.
Sorry.
Don't you?
Sorry.
Yeah. Ready, break. Wow. Wow. You know, there's this Merlin reporting system for results. So Quest and LabCorp are plugged into this Merlin reporting system. So when we get a negative or a positive result through Quest or LabCorp, Quest and LabCorp automatically sends this into this Merlin database. So the county, all the counties can kind of instantly look on the computer and see the status of how many we've tested and how many are positive, and we can get data from that, and it helps with tracking and surveillance, and so it's important. Mark Lander himself, the head administrator of the health department during a pandemic, yesterday for 3 hours was manually entering data into the Merlin system, because there's lots of other labs that don't report to the Merlin system, like AIT. What we want to do is we want to try to support the health department, because he needs it. He's a great guy. He's a super nice guy. He's doing the best that he can. He's working like 20 hours a day, 7 days a week now. It's nuts. So if we can fax all our stuff that we have to that phone number.
Okay. With results.
So it'll be the results that we have, you know, those negatives, and a face sheet. And then if you can get with the other clinics that may not know for sure what to do.
Okay.
Any questions about what our plan is? So let's help the health department, because they need it. After talking to, he called me last night when he was on the way home, 8 o'clock. He was on the way home and he told me everything that he was doing. Oh my God. I'm like, oh, Mark, you poor soul. Let me help you. So he texted me just a little while ago that info. So let's help him out.
Okay.
Okay?
Alrighty.
All right, ready, break. Shirley,
Yes,
will you be a pretend COVID patient?
I will.
You don't look very sick for a coronavirus patient. All right, so here's what I'm going to demonstrate. You know, we have some people that are positive for COVID that are watching our videos. We have some people that are having significant respiratory symptoms, and we want to teach them what the pulmonologists are doing and using to help to minimize or reduce the risk of the viral pneumonia complications that people get when they're in the hospital. So let's do that. So if you could just demonstrate what that is.
You want me to demonstrate what the pulmonologists tell
Yeah.
the patients to do? Mm-hmm. I'm not sure.
You want me to do it?
Yeah.
Okay, so the first thing is let's demonstrate a breathing exercise. And so a part of what happens in the lungs when you're sick and you're laying in bed because you feel so terrible, right? Mm-hmm. You have the flu, maybe, you know what it feels like. You just lay in bed for just, days and just, lay there. The problem with laying flat is that the weight of the organs and structures on the front of your body when you're laying down kind of weighs on the lungs, especially the bases of the lungs, the bottom of the lungs. And you get this thing called bibasilar atelectasis. And so those air spaces inside the lungs don't open up and expand. So the first exercise that people should be doing is a deep breathing exercise. So we're going to do a practice run, me and you together right now.
Okay.
So it's a full deep breath. And we're going to hold our deep breath for 5 seconds.
Okay.
So as full as you can go. Ready?
3, 4, 4, 7, 1.
you would do that same cycle 5 times. Might get a little bit lightheaded when you're doing it. I feel a little lightheaded for just that one. Just that one. Just, it doesn't have to be right back to back. So with that deep expansion to open up those, especially those lung bases, and get those air spaces open to prevent that atelectasis. That's where that pneumonia starts, when those air spaces stay stuck together and close down. So you want to do that cycle 5 times. Doesn't have to be back to back to back, but you know, within a couple of minutes. And then on the last one, you want to do a good cough to sort of create more pressure right at the end to sort of open up any other little spaces that hasn't. So we're gonna do the same thing, but instead of the exhale after 5 seconds, we're gonna give a little cough.
Okay.
Ready?
Yep.
Okay, so that little force that you create there helps to open up those spaces. So very useful a few times a day, at least on that. You're not gonna feel like it because you're sick. There you go. Okay, so I know you're sick and you don't really feel like it. Don't cry. I know you're sick and you don't really feel like doing it, but incredible the difference that it can make. So the other thing that we wanna do is something called chest physiotherapy. So will you do chest physiotherapy on me?
You want me to do chest phys? I don't know what it is, but.
Can you try?
I'm just kidding.
All right, I'll do it to you then.
Okay.
All right, so spin around. So in people that have chronic lung diseases and they're admitted in the hospital, things like pneumonia, there is a bed. The beds in the hospital have this vibration thing that they'll do, or they even make a vest that you can wear and it creates a vibration to help to rattle the mucus and the stuff inside loose and to break it up and get it easier up. So this is what it looks like. If you're gonna do it at home, you can get anybody to do this on you. Just hunch your shoulders a little bit and you're just gonna breathe deeply and you just wanna hit the back like this. This is not a free massage. Up and down the back here a little bit, kind of like this. And you do that for about a minute, but I'm tired, so stop. So, and doing that a few times a day to help to kind of rattle that mucus and to help you to get it up. So the breathing exercises and that chest PT that we just described can make a huge difference
I could see.
in people that are getting the respiratory complications from COVID, or really any respiratory complications. So great work for teaching us all how to do these pulmonary exercises to keep us all healthy. Is there anything else that you'd like to say while you're on camera today? How about your shirt?
We just. Kelsey made this shirt before me. It's Cardi B yelling coronavirus. It's like a TikTok type silliness.
You kids and your TikTok. Okay, so that's how you deal with pulmonary issues with coronavirus.
Thank you to everyone.
Okay.
And when you're ready, you roll your window down. She'll swab you, and she has to leave that thing in there for a moment. It doesn't hurt, but it's weird.
Right.
You know, it's weird to have something stuck in your nose like that. And then out, and then window straight back up.
Okay.
All right? After they do that procedure, then I'll call you
Okay.
for final instructions.
Perfect.
Any questions?
Nope.
Hang tight.
Oh, are you videoing me?
Oh.
I was showing off my
Hey, what-
quarantine shirt.
Hey, when did everybody change into pink shirts and I wasn't watching?
All day. I made all of these.
Oh,
She made them.
goes to show how.
SK was wearing one too.
I saw hers. Purple one.
Yeah.
Yeah.
We're gonna gear up for a massive week next week. You ready?
No.
I set up my table.
Can I bring a flask to work?
A flask of what?
Sherry, no chaser.
Straight Hennessy.
Yes.
Are we allowed to drink alcohol at work? Shirley said yes. Who's gonna blow steam off this weekend?
Me.
Are, Like, is it more of a blow steam off or more of like a crash?
No.
Okay,
Like, what's the
Shirley's gonna work
feeling?
out.
I'm probably just gonna work out.
Oh, our call with the hospital is soon. Are you kidding me?
We got two of them. There's
Somebody's
another
coming
lady-
from Orlando?
There's another lady
They
coming
can't
from
find-
Orlando on
yeah.
the list.
We have 2 people that want to come from Orlando to get finger sticks?
They can't find
They
nobody.
can't find anybody to do it over there, so they,
One of the ladies
heard
that's
that
coming in
one.
on Monday is actually lives in Tennessee, but she's here right now for work. She's coming to see us too.
Another traveler.
Lovely.
Bring me the travelers so I can wring their
Hey,
necks.
what is it? I'm getting a lot of questions on the phone. Literally, like, when does Dr. Kuhn predict this will end? Yeah, we get a lot of that.
Can we pull out your crystal ball?
And they don't say, when do you think this is going to be over? They say, ask the doctor when he thinks.
It's a good question. Yeah, no, actually it is a good question. So when is this whole thing going to end?
I say July.
May the 20th.
Maybe August.
At like 2 p.m.
May the 20th at 2 o'clock?
I mean, that would be
That's
lovely, but
reasonable.
I don't think that's
Another month.
I don't think it's. I think it's gonna be way longer than that.
I think it's gonna probably be maybe August.
I think it'll be a lot closer to August. Yeah.
So I think the misconception that people have about this a little bit is that this is just going to have an end date, and it's not.
No, I want to know, like,
When can we
safe
leave our
to
houses?
say
Yep.
this is gonna be
When,
passed.
when we have a vaccine. Yep. Like, imagine in Ocala, right? So let's say we're on this lockdown thing, and then, I don't know, a month from now, like mid-May, right? We start opening for business, and businesses start opening, right? We start to go back to work, and we won't have found all the cases. We will have only tested if maybe 10,000 people, 20,000 people. There's 350,000 people in our county, so there's going to be people that walk around. Remember, this is a 21-day, 28-day illness, and maybe it reactivates a little bit in some people, or it kind of lingers longer. So we're going to have new hot spots and new things that pop up with this
So we'll still
for
be testing when
months
this is
and months and months. This is going to go on. It's not going to feel like it does right now. We'll have a much better control over it, and people are going to distance.
Kind of just getting used to it.
You know the days of the handshake?
That's over.
It's over. Yeah.
There ain't going to be handshakes anymore after this. There's going to be people that are wearing masks for months and months and months, maybe at the end of the year.
Definitely.
Yeah, he's like.
And it'll be next year before a vaccine's ready.
nice.
This is a thing that I explained in an earlier video. If everybody in the country, or in the world, if everybody in the world would have just gone home, this is extreme, you can't do this, but if you could have, if every single person in the world could have gone home and stayed home for 28 days,
It would have been done with.
then all the people that were gonna get sick will have gotten sick and either gotten over it or died from it, if they were gonna die from it. And then the virus dies off because it can't spread to anybody else and the immune system has beat it. But we didn't do that. So because we didn't do that, this is going to linger. There's going to be little towns and little hot spots. They're going to call them little hot spots. Are going to be popping up all over the country, all over the world for months and months and months and months and months. So it's not going to feel like this. We don't have to run a COVID clinic, and we're not going to be doing that. But for right now at the beginning, so we can find as many positives as possible, isolate those people, then hopefully we can return to normal in a month or 2 from now. More normal than we used to have. Most clinics stock swabs for flu and strep. A coronavirus is going to be kind of standard swab for probably a few years, like anyway after
And
this.
hospitals, you think, are gonna.
Hospitals, I'm sure, will have that as well. It's going to be a go-to for a while. It's just going to be a part of our routine care. In fact, next January, 8 months from now, if we have someone sitting in this room, in our exam room, and they rolled in and they're coughing and hacking and have 101 fever, what does everybody think they have? COVID. And so this is it next year I'm talking about. And you need to go to the other end of the building, or you need to go wait in your car, and we're going to do a car swab, and you know what I mean?
We already know how to do it.
Well, yeah, I mean, we already know how to do it, but that's how we're going to operate. And every doctor's office is probably going to operate like that. It's, some version of that for a while. So we're all going to be a little edgy about this. Even when we start to go back to our normal life and return to normal, we're all still going to be edgy and scared. Look, at Christmas time, if you saw somebody in the grocery store and they have a cough or whatever, you would have totally ignored it. unless it was like ridiculously loud. But like a regular coughing person, you don't even think about it. You walk by him and you don't even think about
And
it.
now you just stare them down. Like,
If you see somebody that has a cough and you hear it, like, I'm leaving this store. Like, I'm out of here. You know what I'm saying? So, but it'll stay like that. That heightened level of anxiety, that heightened alertness, that's going to stay inside us because of how traumatic this is. The easy thing for us is that we all have jobs. This didn't really kind of upend our life, our personal life in our office that much. And we feel like we're kind of in control because we're fighting this thing. So we're way more empowered than most people are. Most people are home and scared, and they've lost their job, they've lost their money, they don't know when the world's going to go back to normal, they're
That's my
sick with
husband,
things.
And he's driving me nuts. He really
Well,
is.
and like there's events, like I know of 2 events that were rescheduled from like this month until September. That's a long time.
What happens when they try to like start college football season again? You think that, you know, Gator games are going to be full in August? I don't.
Summer's
everything is
canceled.
canceled. My daughter just signed up for cheerleading for the first time.
Yay.
This is the first time she's ever signed up for anything.
Yay.
And she can't do it.
Oh,
Yeah, my son's basketball.
that was a happy story for a
I
minute.
know.
Basketball, they're
Question.
sending us the exercises via email. So he does tele-basketball.
Oh my goodness.
Tele-basketball. Like, I never wanted to go to an NFL game before, and now that I can't go to an NFL game, I just want to go to an NFL game.
It's
It's a great time. It's one of the best times I've ever had in my life.
Yeah.
So I'm just, you know, this space that we've been filming in is usually our waiting room for our primary care doctor's office. But this space has now become ground zero for our COVID response right here in our own clinic. And we're stocked with PPE material. We've got test kits from 5 different labs, and we've got finger stick kits and flu swab kits, tons of them, gowns and gloves and bouffant caps and biohazard everywhere. It's crazy. Sponge gauze. I mean, look at this. This is like a disaster. Face shields. I don't know why we weren't able to crank out 100 million of these things in about 10 minutes in our country. Look how simple that face shield is. There's no reason we couldn't have got this up and running super fast. If I were President Jordan, I would have ran these, I would have started printing these things off the moment we had our first case. 2032 or 2036. If this is what the first month of madness brought into our clinic, I can only imagine what the next month is going to bring, because this next month is when things are going to really get real. We will continue to remain here in this fight now and all the way through until the end. I've got an amazing team here supporting me along the way. I have an amazing cameraman behind the camera getting our information out to the public. This whole thing is going to change us. This whole thing is going to change all of us. It's going to change us as a country. It's going to change us as a culture. And it's going to change us as individuals. And we're going to need strong leaders when we come out of this. But right now, we're still in the fight. Everybody have a safe weekend, and we're going to see you on Monday. Thank you. I just got some excellent news. It's end of the day. Everybody's gone out of the building, actually. I was just on a conference phone call with the chief medical officers at both Advent and ORMC and a number of local physicians and health authorities. Pretty exciting stuff. We were able to get them information about laboratories, AIT in particular, that we have been working with, and some of the finger stick laboratories, so we can get more test kits into our county. I had a question about the possibility of the emergency rooms being able to do more swabs for COVID than they currently are. I'm going to work this afternoon to get our contact information for these labs out to local doctors in the county and to both of the hospitals. Hopefully we'll be able to stock up on these test kits so we can get more testing done, just like everybody knows that I've been working on. Now the medical officers at both hospitals and the health authorities are well aware of everything that we're doing here in our clinic, and we're very happy to be able to help them to meet the needs of the people in our county. So this is a very good development for us. I'm very excited about this. So keep working. Work, work, work. Good evening, Facebook world. It is about 9:15, broadcasting right from my living room. Got my editing station right here behind me. The reason we couldn't get to that video this evening is there's been some very interesting new developments locally. It turns out that there is a group of about 200 local doctors that have already joined forces to try to strategize a better way to deal with this pandemic. They've already done some amazing work. And we are now going to be joining forces, my team and this team of 200 doctors. My intention is to scale up a testing site so we can get some sort of high volume testing site operating right here in Ocala. We want that to be drive up, and I'm going to shoot for free to the public for everybody that may need to be tested. So I've been working on that this evening. So that's the reason we won't be able to get the video up tonight. Apologize and appreciate everybody's love and support as we're working on what we're working on. So look for our update for tomorrow, and we've got other work we're doing this evening. Have a good night, everybody.